The Manitoba government is reviewing an agreement which allows residents to access health services at 2 northern Minnesota hospitals. The decision comes following concerns from residents of southeastern Manitoba who've received hefty medical bills for treatment in the U.S. The latest case to come to light involves a man airlifted to Grand Forks following a heart attack. And as CTV's Josh Crabb reports, patients say they shouldn't be forced to choose between paying or dying.
Robin Milne has a new lease on life, but it came with a hefty price tag. The 60-year-old underwent life-saving surgery in Grand Forks, North Dakota, after having a heart attack last October at his home in Sprague, Manitoba, about 2 kilometers north of the Canada-U.S. border.
And I didn't make it out of the house, and I got smacked really hard. It really hurt.
He was rushed to the closest emergency room, which happens to be in the northern Minnesota town of Roseau. After waiting 90 minutes for a transfer to hospital in Winnipeg, Milne says a doctor advised he go to Grand Forks to get a stent in his heart. Milne and his family took that advice.
Of course, that's our first choice to go there, to Winnipeg, but when life's on the line and death is there, I mean, we went to Grand Forks.
Milne later received a bill for $118,000 Canadian for medical costs in the U.S., which Manitoba Health has so far refused to pay. This despite an agreement which allows residents to access primary care and emergency services at this hospital in Roseau and a second one in Warroad, Minnesota. U.S. doctors are supposed to send patients back to Manitoba to see specialists, but physicians can choose to transfer people to different U.S. facilities.
She said he has to go somewhere now, and that's pretty much what she said, and what do you do?
Milne isn't alone. Sprague resident Verna Kittleson got a bill for $69,000 U.S. for a heart procedure in Grand Forks in August 2015 and a 13-day stay in hospital in the same city later that year. Kittleson ended up paying $47,000 for those services, even though she says a doctor from Roseau advised her to go to Grand Forks.
I was being taken care of. And I would have gone to Winnipeg if they would have given me an appointment. I wouldn't even have thought twice about it.
The health minister says the province is reviewing Milne's case and the agreement with the 2 U.S. hospitals.
Situation and how can we review and change the agreement so that it is made better for people and they're not finding themselves in this situation.
In the meantime, Milne's trying to figure out a way to come up with $118,000.
Feel like Manitoba Health needs to step up to the plate here and cover it and come up with a plan so no one in this area would ever have to go through this hellish experience again, because it's been awful.
If not, he may have to remortgage his home or dip into savings to pay it off. Josh Crabb, CTV News, Sprague.
The health minister says he doesn't have the authority to order Manitoba Health to pick up Milne's U.S. medical bill. Manitoba Health suggests residents look into insurance coverage for any medical treatment which may happen out of the country.